My name is Ruiz. I'm a senior research ethics analyst at UBC. I manage the board as part of my role. And I also do sort of outreach like this and policy and guidance for research ethics at UBC, mostly in the behavioral social sciences side of things. So this is Maria Valente. Maria is the Research Ethics Review Officer in the Office of Research Ethics. She is one of the bedrocks in the office. She does a lot of the vetting of research that comes through us. She also works very closely with the board, as though, you know, I say I manage the board, I really oversee the board, and Maria manages the board. She does the pre-reviews on applications as well, and is an excellent contact if you have any questions about your research, you just want a sounding board for some dilemma that's come up, all of that sort of thing. Maria's here today just to be another person to bat ideas around with. I can see that the group is relatively small. Marilee, do you want me to jump right in, or did you want to say something further?
I was just going to actually add that we also have Bernie Garrett with us here today, and he is our faculty rep on the BREB board. And so really great that he was able to make it today as well, because he has sort of an insider's experience in terms of what that board review looks like and how it works. And then also he has obviously done some excellent nursing education research as well in the school, and also has some sort of experience on both sides of the process, submitting those submissions as well. So perhaps when we get to kind of a Q&A part, he may want to pipe up with his own perspectives as well.
Hi, Bernie. It's great to see you. And I think if either Maria or Bernie want to jump in at any point during my talk to add some perspective, just do. This is it's a relatively small group right now. So usually I like to have a more conversational approach when it is, you know, people come for a certain reason, they have questions that they'd like answered. So probably for the rest of the talk, if you do have a question, just put up your hand and we can deal with it in the context that I'm talking about. If I miss your hand, which is possible because I'm dealing with a whole bunch of different screens here, just somebody jump in and let me know. I will try to break at the end too with some time for some questions, and if anybody has any further questions that they'd like. Okay, so I'll just jump right into it. My first slide here is sort of why research ethics is important. I usually like to start, sorry, again, multiple screens. I usually like to start just talking about this because I think sometimes we get caught up in UBC in this idea that ethics is a bit of a burden and it's bureaucratic, and often the board doesn't understand what you're trying to do. Or we've also heard that it's just the university trying to cover itself legally if anything were to go wrong. So it's always a good reminder to take a sort of a pause and remember why research ethics is so important. And that's really to ensure that we don't intentionally, hopefully not intentionally, but definitely not unintentionally harm research participants. And that is really the BREB's primary role. It is to look at research in the best interest of participants in mind. So sometimes that means that we can't do the most scientifically important thing because it actually may cause unintentionally harm to participants. When I'm grappling with you know, new ethics issues, and they come up all the time, I go back to the core principles in the Tri-Council policy statement to sort of think through any sort of new dilemma, just to sort of remind myself what are the core principles that we're operating by. So just to back up, the Tri-Council policy statement is the overarching research ethics guideline in Canada. It is what we use as sort of our bare minimum standard for guidance around research ethics. All institutions that receive Tri-Council policy money have to ensure that research upholds sort of compliance to the Tri-Council policy statement. in order to receive the money at all, whether it's grant funded or not. So all research needs to meet these standards. There's 3 core principles in the Tri-Council policy statement. The first is respect for persons. This has to do with obtaining a person's consent and respecting a person's autonomy for consent, or their individual autonomy, while protecting those with developing autonomy like children or minors, or those with diminishing autonomy. So this could be people with cognitive impairments or mental illness. The respect for person also reminds us that although people may not have the capacity to consent, they should still be involved in the consent process where possible and where appropriate, and their assent or dissent to research should be respected. So respect for welfare involves minimizing the risks while maximizing the benefits. It involves the concern for participants' privacy, but it also goes beyond the individual to the communities and groups that the individual belong, and it ensures that research doesn't end up stigmatizing or discriminating against a particular group. And there is lots of historical examples where research results, when reported, results in stereotypes or discrimination. So justice is treating people fairly and equitably. It ensures that not one group of participants takes on the burden of research without receiving the benefits of research. All researchers at UBC do need to do the core tutorial, and I'm assuming probably everybody in the room has done it. It has been updated recently. It does now have the chapter 9, the Indigenous chapter. It is very text-based, and so although we have to do it, I wish we could have a bit of a better tutorial, but the information is really relevant and important. Okay, I'm going to move on to when do you need ethics review. So essentially, any research being done on human participants or their data may require review. So to break it down, it helps to understand how the TCPS2 defines research in human participants. And so the TCPS defines research as an undertaking intended to extend discipline through a disciplined inquiry or systematic investigation. So a disciplined inquiry here is the inquiry conducted in a manner in which your colleagues in your department would consider that research. So because, especially in the social sciences, we're dealing with so many different disciplines, so many different methods, often we have to go back to what would the department head say? Is what I'm doing sort of holding the standards of the discipline that I'm in? And if it does, it's very likely research if you're involving humans and would require review. I want to draw your attention here to just this research intention. We're going to talk a little bit about the difference between QA, QI, and SOTL, which I know is something that's come up I'm working with the Faculty of Pharmacy right now, and also the Faculty of Nursing. I understand also has a lot of sort of scholarship of teaching and learning. And I really wanted us to sort of think about research as it's not the methods that we're using as much as the intention behind what we're doing, which will define whether something requires review or not. So I'm going to come back to that, and we're going to talk through that in a case study. So it's okay if that's a bit confusing at this point. Is there any questions so far? No? Okay. So research that does not require review. So this is what we would fit into that definition of research, but that would not require review. And that's research that is publicly available, secondary use of anonymous data. So this is data that was collected originally anonymously. So not data that has been de-identified, but that never had identifiers attached to begin with. And then human biological materials, which UBC policy kind of contradicts a little bit, in that there can never be anonymous human biological materials. But if you are doing secondary use, like surgery, leftover tissues, that sort of thing, you should check with the REB to make sure that you wouldn't require review there. Naturalistic observation of people in public places where there's no expectation of privacy. So the key here is no expectation of privacy. So people out and about, let's say you're studying crowd formations in the university campus and you're looking at how students walk around the fountains or gather in certain social places. Expectation of privacy is flexible, so it's not, in one circumstance, there may be a heightened expectation of privacy. In another one, for example, watching kids play at a park, there may be a heightened expectation of privacy in that you're not being researched in that activity versus the crowding example I just gave. If there's ever any doubt about that, please sort of reach out to our office. Okay, so projects that do not require review. So those that are considered quality assurance, quality improvement, or program evaluation, where the data collected is only used for assessment, management, or improvement purposes, would not require review. So an example here is an organization running pre-existing programs, and they do an evaluation on that, and then they use the results and they feed those results directly back into the program for change, and then change is implemented. So often one of the sort of criteria that I think about when people ask me about QA/QI versus research, and it comes up all the time, is what you're doing, are you able to implement change into that program? Because sometimes people will call something QA/QI, but it's not their program. They weren't asked to do it, nor do they have the authority to make any changes over it. So you might see that in student research, resident research, practicums, that sort of thing. It's just something of interest to them. And so it becomes blurred there, whether or not that would be considered QA/QI or research. We do have a check list here for QA/QI, and I'll be honest, it is good, and definitely the cover sheet is worth reading, but it's not excellent, and we are in the process of redoing it. So one of the projects we're doing right now is we're creating a digital tool to help people walk through their projects and whether or not they require review. And it's specifically designed for both research that's happening in health authorities or more health or biomedical research, but also SOTL, institutional research, program evaluations, needs assessments. And to try to kind of distinguish that murky line between what is required and what is not. I'm hoping what's going to be awesome about this tool, and I have high hopes, I'm really glass high, kind of full on this, but I'm hoping what it'll do is it will be able to tell people whether their project requires our research ethics. But if it doesn't, it will give them resources around what are some of the ethical dilemmas that can crop up in any project, because a QA/QI project doesn't require a formal ethics application. It doesn't mean that it doesn't require a consideration of ethics within that project. And usually we defer to departments or colleagues, or sometimes there's ad hoc groups within departments that review these to make sure that, just have a second set of eyes on a project to make sure that your approach is the most ethical. So this tool hopefully will either spit out you need REB, or it's going to say you don't require research ethics. However, you may want to consider this, this, and this within your project. And we'll talk about some of those issues, because ethical issues can be the same or slightly different in QA/QI projects. Are there any questions at this point? Because I know this was something that I was asked to speak about. We're going to jump into a case study right now and hopefully pull this apart a bit. Nothing? Okay. So I'm going to go to, no? Yes? Okay. I'm going to run into a case study here. So this is a scenario. And then what I'm going to do is kind of evolve it a little bit, because one of the things I hear a lot from researchers is that, well, it didn't start as research and now it's become research. And so I'd like to kind of unpack that a bit, and please ask questions along the way, and understand that this is a bit of a murky area, so it's not always really straightforward. So the first scenario, you are a teacher and have added an online module to a face-to-face class that you've been teaching for years. You would like to know what the students thought about it and whether or not it actually increased retention on a particular topic. You design an evaluation that students fill out anonymously on the last day of classes. Once exams are graded and marks are in, you use the survey results to inform your teaching practice and design for the course in the next year. So think about this one, and based on what I told you about the definitions around QAQI and SOTL, what would this require a review? Nobody wants to talk, you can pop it in the chat. Our hands. Nobody? Okay. So here you see a teacher sort of go ahead.
They did respond in the chat. They all said no.
Oh my gosh. Okay. Sorry. Thanks, Maria. Can you watch the chat? Okay, there's another window. Now I have another window. Yeah, you're all right. Yeah, this does not require a review. I mean, this is being done within the mandate of being an instructor at the university or in a classroom. You're, I would assume the institution wants you to improve your practices, and you should constantly be thinking about ways in which you do that. And a good way of is to ask the people that you're teaching for feedback. So you are using a survey here. That's a research it's a tool for research as well. Sometimes people say, yeah, but I'm going to be doing, interviews, and they kind of latch on to the fact that there's interviews as being the telling indicator of whether it's research or not. But your methods and your mediums are not necessarily what we're looking at when we're determining whether something requires review or not. It's going to be the intent. And the intent here in this project is just to become a better teacher. So sub-scenario 2, did it switch? So based on the survey, you want to know more about how you could further benefit your students using this medium. The following semester, a graduate student announces to the class that you would like to hold an informal focus group after grades are submitted for the term around technology used in the classroom. You audio record the group. The results of the focus group directly inform how you will investigate technology into your teaching. As you found the results so compelling, you submit an abstract to present the results in an upcoming education and technology conference. What about now? Got 2 yeses. Oh, three yeses. Does anybody else want to? Does anybody want to say why they said yes? So it's not anonymous. Not only to improve practice. Okay, so those are really good points, and let's talk about those right now. Anonymous is another one of those indicators that I often get. Hey, Jean, I'm doing a survey. It's whatever it's about. It's completely anonymous. So I probably don't require a review here. And then this is a research scenario, so it's not necessarily QAQI, but anonymity becomes this sort of indicator of like risk is part of the determination. And it's interesting because risk is actually not one of the things that we look at when we're determining whether something requires review or doesn't. So in this case, I would say that it's no longer anonymous, means that there's now ethical issues in this project that need to be thought about, but the intent hasn't changed. The intent is still to look at how to further evolve technology in the classroom. And the other, so I'm using these research, I'm throwing in focus groups, I'm taking away anonymity on purpose to sort of, force you to think about how you would approach this differently. And the last bullet there, often this idea that, you say the intention is not to improve practice anymore, but I would say in this scenario, the fact that you found the results so compelling wasn't the original intent of the of doing the focus group. Your intent going into this was simply to improve your teaching, but you found something that was really surprising. And so publication in this case, sort of to present at a conference, doesn't necessarily make something research because you didn't have a research intent up front. And what I would say here is that you would have to ensure that you're presenting what you did. Of course, you're going to have to think about how you've ethically mitigated, and hopefully you did that before you even started this. But you're not going to present this as research. You're going to present this as a QA/QI activity or a SOTL activity you did in your classroom that just happened to have interesting results, but you weren't upfront thinking that it did. And the other thing in this scenario is if you wanted to publish this in a robust academic journal, they probably wouldn't accept it because you hadn't really created a big enough sample, or you weren't really thinking about the method as a primary reason. Like your design wasn't to be published in an academic journal. Your design was to just give you some more information about how you can work with a set of students in a particular class. So, you know, there's sliding scales here, and this is where it gets a little bit murky. So I'm gonna go to one more scenario. So this is sub scenario B. So you're going back to that original survey that was anonymous, that didn't require review. And now, instead of doing what we just talked about, you were quite surprised at the responses in the survey, particularly around the adjectives to describe the technology used. You decide to initiate a further study on culture and technology. You put a recruitment ad to invite students who were in the class to participate in focus groups to talk about their backgrounds and perceptions of technology as a learning tool. You plan on publishing the results in an academic education and technology journal. So would this require review? So I'm getting yes. Yeah. So you can see here how it sort of shifted from being a sort of a more abstract academic sort of question or query to something that, it shifted from being a QA/QI improve my practice to being more of an academic query that, you know, in generic ways may tell people about culture, technology, and technology uptake in the classroom, but you're actually, the intent here is to publish it and generalize it across a broader audience. So you may be using multiple classes, you may be using your focus groups as a jumping stone for further research, et cetera, et cetera. So, you know, to me, this, you often see variables that you don't need. That's the other one that is kind of an indicator. If you start to be curious about something that's not really going to directly inform practice, but would be, you know, interesting on an academic front. So, you know, I can't think of one right off the bat, but they're generally a bit more robust measures. You're asking more personal details. So, you know, saying that anonymity makes a difference, it does if you start to ask people, let's say, their backgrounds, their demographic information, when their birthdays are. So you're now looking at younger students versus older students, and you're crossing it over multiple years. Like it starts to look a little bit more robust from a research perspective. Are there any questions, or is there any pieces of this that people would like to talk out? And I'd also, if people have personal examples in this area that they'd like to discuss, this would be a good time to talk about it. Or if you disagreed with me, that's a good one too.
Hi, Jean.
Hi.
Sorry, I'm just moving my camera, so I'm actually looking at you. I'm just curious about your take on SOTL activities. And how is your definition of subtle activity different from sub-scenario B? Because it sounds to me like this is scholarship of teaching and learning.
Yeah, so I would say that this is scholarship of teaching and learning that requires review, and some scholarship of teaching and learning doesn't, and some of it does. And so I actually thought of including a SOTL definition in here, and I probably should have. It can be something that we can think through, but basically with this tool that we're doing with pharmacy, that's exactly what we're trying to tease out. You can't just exempt SOTL altogether. Not only that, because SOTL is also under the premise that it is robust research at times, and people don't like you telling them that what they're doing isn't generalizable or more, you know, if that makes sense. Sometimes it is and sometimes it's not. Robust is maybe not not the best word, but let's say contextual, like it's so specific to a certain situation that it may not be, you haven't tested whether or not it's applicable in other situations. But I would say that when it comes to the scholarship of teaching and learning, to some extent, I would say all of this sort of fits in there. Even the last one that requires review, the second one as well, you know, and there is times where you would have to get review and not get review. And I think if I could give advice, and please call if you want to just talk about it, you know, it's sort of what is your intention up front? Because when you start to think about, well, my profession is, you know, I'm in the faculty of nursing, I'm teaching nursing, but I'm also advancing a portfolio of research around the scholarship of teaching and learning in the area of nursing. And so that is also an academic pursuit as well. There, you know, you do need to sort of do that double check about what's the purpose of myself doing this. Is it just to improve this particular classroom, or do I want to add to the body of literature for the scholarship of teaching and learning? Bernie.
Hi, yeah, I'd agree with that. And also, sort of having worked a lot in this area, one thing to consider is with most SOTL projects, as Jean sort of pointed out, when you come to publish, what the reviewers will usually look for is in their checklist is, have you had an ethics review done before you publish? So, you know, you're going to come up against this if you haven't done that, and you're arguing it's a QA initiative. So my recommendation is always, you know, play on the safe side, think in advance, and it's good practice to apply for an ethics review if you're planning to do several activities that you think you're going to publish, because as I say, it saves you headaches longer down the road, and often rejections are outright simply because there's no ethics review done.
Yeah, Bernie, I have a question, and this is just if we can have a bit of an exchange here on that. I completely agree. If your purpose right up front is to have it sort of in a SOTL journal, you want to make sure that you're looking at the requirements. But historically, and before SOTL became, you know, SOTL is becoming very popular, I would say in the last 5 to 10 years, but mostly in the last five years. You may disagree there, but I'm seeing it a lot more. And so maybe that's a bit anecdotal. I used to say that publication isn't the litmus test for QA/QI, because it, you know, often, you know, there are interesting things that come out of an experiment that you do with your classroom, or, you know, a program evaluation that you weren't expecting to need to publish it, but usually there are restrictions, and usually very robust academic journals that are going to be looking at methods wouldn't accept those. But there are SOTL journals or QA/QI journals that may accept stuff that doesn't require review. And I have historically told people, if the intent wasn't research, to tell the journal, and when they say, was ethics review required, you say no. Article 2.5 of the Tri-Council policy statement says that QA/QI projects, and SOTL's a big absence in the TCPS2, and it is something that we're trying to pursue to get them to acknowledge. But I'm asking, so but my question to you, Bernie, is, do you think that would still work?
Yeah, no, it's a good question, but I think things have changed. I'm going to give you an example. I mean, I've been on the editorial board of a couple of journals, and for example, been on Smart Education and Technology for about 10 years, and their policies changed as well, mainly in this respect to this, because when you're reviewing work, you're not always sure how much information was actually given to the participants. So it's not the reviewer's job to do an ethical review on your paper that you're submitting. And the only way they can know if it's been done properly is if that ethics review has been, you know, you're actually stating it was undertaken in your paper. And the reason is that a lot of SOTL activities involve an experimental introduction of a new technology or a new teaching approach, some sort of methodological trial that is done often with a control group, or, you know, against another class or cohort who didn't have it, or sometimes with pre-test, post-test, but it usually involves some sort of experimental approach to teaching or novel introduction. Now, when it happens, the question then arises, of course, were people informed? Did they have any choice in this? If not, and all those sort of questions that would normally come about in a good ethics review will obviously explore those. And again, that's the issue. The journal reviewers and the journal editorial board aren't in a position to say whether that was done or how informed the participants were, whether it was fair on the participants. So very much rely on the ethical review. Having said that, there are journals around who won't ask for it, so people can get around that. But like I say, my advice to people who are engaging in these activities is, it's pretty easy to get an ethical review done now with our excellent systems here at UBC as well. So why wouldn't you do it? And also it's good development activity. So if you've got any thoughts that, well, down the road, I might want to publish this or might want to use it for research, or, part of my purpose for doing this isn't just simply for to improve the course. It might be because I've created a brand new teaching approach that works brilliantly and I want to publicize and disseminate it. Then having that ethics application in the bag will help you out. But it's an interesting one, and I do appreciate views do differ in this amongst journals as well.
Yeah, and so I think we should follow what Bernie's saying here. I do think there's different activities where it's easier and more obvious that ethics review wouldn't have been required. When it gets murky, depending, you don't want the journal to disregard your work just because you didn't get ethics, even if they kind of agree that it didn't require it, but that you don't get a check mark beside your name. I don't know how it works. I think Bernie's experience sitting on the panel is probably something that's worth thinking about. I'm blanking what I was going to say. Oh yeah, one of the things we'll talk about in a minute is really just sort of the benefit of going through the ethics process and how it creates this sort of step-by-step, what is it you're going to do, how are you going to do it, and what are the different interactions you're going to have with participants. And it really forces you to think through things before you do them. And I think in that way is a really useful process to go through, whether or not you will require a review or not. So you could use the application regardless of whether you submit it. And it should, in the end, help you think through all these sort of different pinching points. And we'll talk a little bit more about some of those in a minute. I do have one more scenario. It's 12:36. I'll do it. I think this is one of the areas that people like to think about. So the second scenario is you're a UBC faculty and you decide to write a retrospective reflection on your professional growth and your teaching style over the years. You intend to publish the piece as research. You kept detailed journals of your practice over the years, and you will use these along with secondary literature. There'll be no names recorded in any of the reflections. Would this require a review? We have a yes. Is that a yes from now? No, that's from before. People aren't sure about this one?
I'm just thinking, because it's your own data. You're like the participant, you own it, you give consent to it. I would say yes. The reason why I hesitate is you intend to publish the piece as research. Like, what you mean? Like, what do we mean by that? That you had like a research question that you wanted to answer, type of thing?
Yeah, I mean, the purpose of publishing it is to generalize about your teaching career, which may have spanned 40 years, reflections, these sorts of things, but you're not publishing it for particular improvement in a class or a program, or it's kind of like retroflective practice, which is is sort of a research methodology. So in this case, I would say that if you are solely looking at your own self-reflection, so you see this in teaching as well. We see it, this comes out a lot in practicum students doing masters in education, when they're in the classroom with kids and they're reflecting on different things that they do, and whether they worked. If your reflections are retrospective, so that this means that I'm thinking about last semester, I'm using maybe my teaching notes, but I'm not prospectively kind of interacting in research activities that I've premeditated. I'm not changing anything I would normally do. I'm not using names or any identifiable information, and it's really from my perspective as like the sole participant. We wouldn't necessarily require review for something like this. The next question here is, does this require review? What if it was prospective? What if you're planning on observing how you interact in a particular way? So let's say we go back to the technology example, and you've decided that you want to do more of an observation, retrospective reflection of your practice, not retrospective, it's prospective reflection of your practice. You're going to do it in a more intentional way, looking, maybe dialoguing a bit more with a research intent in mind. And you might use, let's say, the student assignments to also supplement some of your reflections. What about in that case? Yeah. And another thing to think about in ethics is often in the first scenario, again, I always go back to that intent. There wasn't an intention over the years that you were collecting data for, maybe you had a vague, one day it would be nice to rate about my career. But really you have a practice of rating on a daily basis, sort of things that work, things that didn't. And you're doing that because you're trying to improve your practice in the moment. And, but you keep all of these, but you didn't have this research intent, like where you were focused and really thinking about ways that you could use information for research in the future. But if you do develop an intent and you want to deliberately interact using that intent, it's a bit of an integrity thing. And that's why I always say this is murky. But if you know in advance and you're interacting with participants in a research context, you have an ethical obligation to tell them that you will be using their research or their information for research purposes. That's sort of outside of what you're collecting. And the way we approach consent in ethics is usually you start there, that consent is required, and then you work back from whether or not there are exemptions and things like that. But usually, if you're interacting with a person in the moment, you're collecting their information for research data, it's easy to ask them. You can't make an argument that it's hard. They're right there. So with students, of course, it can be complicated because there's undue influence and power over relationships, which we will talk about next or very soon. Okay, so the couple hints, which I think were probably kind of obvious at this point, is the project being done within the mandate of an organization, or is the activity condition of employment or done as part of your employment? Is the data being used exclusively to inform an improvement initiative, or is there a secondary interest? Keep in mind that you can have both. Both just means review is definitely required, but it's okay to have both. So if you are both improving a practice and having a research intent, it sounds to me like you are faculty at UBC. So it's kind of, it's not always one or the other. The next section is how to apply. I might actually skip over some of this. Does anybody have any further questions on this piece? Yes. Yeah. Nelson.
I have a question around the types of projects that do not, according to what we just talked about, do not require ethics review. So those, for example, that are purely intended to improve our practice of teaching and learning. I'm just curious about if the intent of review is to respect persons and respect welfare, then how do we ensure that those evaluations, even if they're purely based on improving our own practices of teaching and learning, they're still ethically conducted? Like how does the university, I guess I'm just trying to wrap my head around, how does the university ensure that when their faculty engages in these I guess, quality improvement activities, they're still being conducted in an ethical manner because students are still involved, right? And data is still being collected
Yeah, no,
or with students.
yeah, I completely agree. And I really need to emphasize that just because something doesn't require a formal institutional research ethics review does not mean that there are not ethical issues, and sometimes very serious ethical issues in the project. And this is where I'm hoping the tool will at least give people some information about how they can mitigate, because it has a risk section. So it's going to identify some of the stuff that may be risky. Power over relationships, dealing with students is going to be in that. And so it'll give you some tips on how to mitigate some of those risks. But essentially, the university, as far as I know, has no instrument to really be looking at these projects from an ethical perspective. And they're using students and student data all the time, not only for SOTL stuff, but for, you know, administration stuff. And so how does an institution think about this? What I've challenged departments in the past when they ask is that there has to be some sort of pharmacy as a group of people that kind of get together, and I don't know how it works or how formal it is, but they can, you know, sort of some peer reviewing of the projects, or having a committee within your faculty or in your school take a look at some of these projects. You know, I would love for us to be able to have the capacity in the ethics office to take a look at these projects, but we just don't. Honestly, it would probably double our submission, and the university is not going to give us double the staff. But and the other kind of caution I have with these is, you know, there are slightly different yardsticks. There is no reason you can't use the principles in the TCPS2 and, you know, issues around confidentiality and informed consent as sort of where your ethical guide is, or but there are other things that may come into play with this that we wouldn't allow in a research context, but would be okay in a QA/QI context. Extreme example, but you may be obliged. This is an extreme example, and it isn't a SOTL one. But let's say you're an employee at in a company that requires drug screening as part of your job. You can be compelled to do that if you want to keep your job. We would never let that happen in research. You know, it's sort of a there's sometimes you have to participate in certain things, and one of the voluntariness is one of the you know, the benchmarks of research. You know, the participant, where, you know, it has to be given the opportunity to not participate, and that's informed consent. But in QA/QI, even in SOTL, like, you know, you may have an assignment that everybody has to do if they want to get a grade. And if you're using that assignment for research, you can see how that could start to confound the issue. So there are certain yardsticks that are slightly different, but they're only slightly different. They're not that far off. So I would say fully be comfortable using a lot of the yardsticks of the research ethics application, and think about having something in the School of Nursing that helps set standards and precedent for this type of activities in the class, even transparency for the students, so they understand that you're a teaching faculty that is constantly doing these types of activities, and that there should be a sort of an expectation or awareness that when they're interacting in class, that's going to be analyzed for improvements, not only within the school, but potential SOTL activities that could be published. Yes, the Recce tool. Yeah, you could use a Recce. A Recce is mostly used in healthcare. So the Recce tool is a really good example of what we're trying to do with this other tool, except for we want to make it more specific to the exactly this SOTL and institutional research type of activities. A Recce is more used for health and health authority type research and program evaluations, and even clinical care type improvements in health authorities. it's going to be similar. The tool will be similar and different. It's going to have a branch off. So SOTL and educate. It's iterative right now, so don't quote me if this is not exactly how it turns out. But SOTL, QA/QI, academic settings, institutional research will answer a specific set of questions that are relevant to that group, and then the biomedical health authority type projects, and understanding that a lot of faculty work in health authorities and there's overlap, will answer other questions. And so one will deal with students, the other one's going to deal with patients and patient charts and things like that. But absolutely, that's something that we're trying to look at. And again, that scoring system is going to be built into the tool. It's not going to look exactly like that one, but it'll be similar. And the other great thing is we'll have access to it. So if you fill out the tool and you get this sort of certificate at the end that says you don't require a review, and then a journal asks you, you can ask me to write a letter, say I filled out the tool, I can look into the tool, see what you put in. And, it's just going to give people a little bit more, it's independent, more confidence in their own independent decision making. It's just, so yes, that's what we're looking for. And I really hope, probably, I don't know, I say spring, but probably you need to add a couple months onto that. We're in the process of doing that. Okay, so the next slides here are really just informational slides, and I think that I'm going to just hand over the slide deck to you. It's sort of how to apply, and so this is going to go through the RISE system. One thing to know is that we are now harmonized in BC. We have a huge amount of something like 22 different institutions are now streamlined into our ethics projects. So if you're working with a faculty or the School of Nursing at Simon Fraser or University of Victoria, you still only have to go through one ethics process, and this is meant to sort of, reduce redundancy and review. The RISE application is these are step-by-step slides that kind of go over how to get access to RISE and the different pages. I'm going to just leave them because I want to talk about, you'll get these, just some of the common, lots of animation. So I'll maybe leave on some tips. One is be consistent when you're rating your ethics application. Ensure that one of the things that happens when people rate ethics applications is that they're composing as they go, because even if they had a grant application and they had to really think about what they were doing within the ethics application, they didn't have to fill out that step-by-step kind of what is it I'm doing with research participants. And so they end up doing that while they're doing the ethics application. And so you're thinking about what would be a good idea. You've got approval for focus groups, but maybe you didn't think about whether or not you're going to audio record them or video record them. You get to the section in the consent form. So you didn't write that into your ethics application, but you get to the section in the consent form. You're using the consent form template that says, disclose whether you're audio recording or video recording. You're like, oh, that's really good. I need to video record. Of course, I'm going to video record. So you write it into the consent form, but it's not in the ethics application anywhere, or what you're going to do with that data. And so those types of inconsistencies, they're normal and they crop up. So don't beat yourself up about them, but take some extra time at the end to really read over your ethics application and ensure that things kind of line up. A good example is that people often get time. How much time do we need participants for? The application will state 30 minutes to an hour. The consent form will say 1 hour to 2 hours. And the sign up for an interview says 30 minutes to 2 hours. You may not think this is a big deal, or maybe it's not that ethical, but for a participant who's trying to find, childcare, and they're trying to figure out whether they need childcare for half an hour or 2 hours, that can be a big deal to them. And so, and it's also depending on what the nature of the project is from an ethics perspective. If it's a really upsetting topic, we may be thinking about that differently in a 2 hour scenario than we would in a 30-minute scenario. So there are things when they seem fairly minor that we would pick up in the ethics review. This other one was this sort of consideration of undue influence, and this is sort of very common in SOTL. It's just when one person is in a position of power over another person. I would say the sort of tip for ethics applications is, rather than skirting around ethics issues or just sort of subtly suggesting or mentioning it, just nail it right on the head. This is the issue in this application, and this is how I'm going to mitigate it. So for to avoid possible undue influence, or coercion is a bit of a strong word, but you could use third-party recruiting. So you often see people who are not, like graduate students who are not directly involved in the actual research project, announcing a research project and collecting consent forms, and you know, there's a bit of a third party there. Collecting data anonymously, obviously, again, protects a person's sense that they have to participate because they have a secondary relationship with you, because they're your teacher or supervisor. And then the last one is having a third party de-identify the information. You may need those identifiers, but someone else can pull off the actual identifying information and link what needs to be linked. And then you won't know actually who the participants were. And there's other ways too, but these are just examples. And yeah, I'm gonna end it here. I have a whole bunch of examples. I thought we had some good conversation. I will make sure that you get these slides. There's a whole resource section at the end, including our website. I want to draw attention. Here's where our templates and guidelines are. We have so much on our website, and sometimes it's just a matter of going and figuring out where it is. The RISE website is different than the ethics website. So if you go to log into the ethics application through RISE, that's not the same as the Office of Research Ethics website where all the information is. A lot of people confuse the two, so they don't think that they have this kind of information available to them. In this, I want to highlight that we're still in COVID times, so there are still COVID restrictions for in-person research. And I also want to highlight that we've just launched an Indigenous Research Ethics page on our website, which is going to focus on community-based Indigenous research. It is mostly focused on non-Indigenous people doing Indigenous research in community. If you are an Indigenous person, I would reach out to our office, and doing research in your own community, the parameters are a little different. So reach out to our office for a conversation about that. Any last questions? Sorry to rush here at the end. Oh, and there's also a survey at the end if you'd like to give us some feedback. I promise I won't use it for research. Okay, well, if nobody has any other questions, if something comes up, do reach out to us. We like doing this sort of thing just to get it, you know, put a face to a process at UBC. We do pick up our phone. Well, less now that we're all working remotely more, but we will, if you leave a message, we get that email and we call back almost within 24 hours. Email is a great way. We do consultations. We're available, so.